Hi, my name is Greg Fell, I'm Director of Public Health Sheffield, and this is a short video on today's position statement. So we've seen over the last couple of weeks a significant rise in incidence and a significant uptick in the positivity rate, the proportion of people who take a test who test positive, neither of which is trivial and neither of which is of random fluctuation. There's a definite rise in Sheffield, definite rise nationally. So as of yesterday, the 7-day instance was in the order of 60 per 100,000. That's been going up quite steadily for the last few weeks. We have pushed quite hard on testing over the last couple of months actually, and there's still more to go at, so we'll keep pushing in that space. And we'll be intensifying a range of interventions across lots and lots of different areas of the outbreak control plan that we've published. We still have the right strategy, keep people safe, protect the vulnerable, reopen Sheffield and follow government advice. We're still seeking to avoid two things: the direct harm to individuals of a dangerous respiratory virus and the indirect harm on the social and economic impacts of a lockdown type of intervention. So numbers are growing rapidly. Numbers are growing across the north of England. Yorkshire is slightly behind the northeast and the northwest. We're probably 2 weeks behind where the numbers are in other parts of the north of England. But that will change. I'm not expecting the rates will start falling anytime in the next few months. We can change the rate of growth. We can't make growth zero, but we can change the rate of growth. Those who are testing positive are still mainly youngish working age people, and hospitalisations are still quite low, but they're not zero. So there has been a slight uptick in the number of people hospitalised. That's of concern. We're beginning to see transmission amongst older people. So whilst most of the transmission is in younger working age adults, we're beginning to see some transmission in older people, and that is very, very worrying. Mostly it's household spread, and it's household spread across the city. It's not now just in the east of the city, it's household spread across the city. And that again is not trivial and certainly not something that we will be ignoring. So the overall epidemiology picture is pretty much the same as national. We're slightly ahead of most of the south and the east of the country, but slightly behind the north of the country. There is zero chance that we will be able to contain the spread of the virus to only youngish, wellish people. There's no doubt that there will start to be transmission in older people. I'll underscore, objective number one is to keep people safe. This is a dangerous respiratory virus that's had significant impact on hospitalisations and death, particularly amongst older people. So whilst most young people will probably be well, our collective responsibility is to keep those who are vulnerable as safe as humanly possible. There's no single thing that you can say that is the thing that's leading to the transmission. Probably some of the transmission is travel acquired outside the country and inside the country, and of the about the half of transmission that's within the city, it's in order of importance: house party, household visits, visiting pubs and or other hospitality venues, cafes, etc., wedding and other. So we know that most of the transmission is household related transmission. So and that's we're directly addressing those kinds of things. The rule of six remains important, and the rule of six is there for a purpose. It's to stop household transmission, big mixing of different households, because that amplifies and accelerates transmission, and that's there for a purpose. To an extent, most hospitality venues, most pubs, most cafes, most restaurants are COVID safe. They're acting within the guidelines. Some aren't. We know some aren't, and we have regular reports of places that aren't, but most are. Most people are broadly behaving as they were earlier in the summer, but certainly behaving in a very different way than they were this time last year. So social distancing is still in place, wearing face masks is still in place, people don't hug as much, people don't shake hands as much. Older people are certainly being much more cautious, hence we're seeing a much more delayed impact of spread in older people this time round. The strategy remains broadly the same. We are acting to keep people safe. We're acting to protect the vulnerable. We're trying to reopen Sheffield. Nobody wants Sheffield to be in another lockdown, and nobody thinks that would be a good thing to do. And we're certainly continuing to follow government advice. But one thing will happen over the course of the autumn. The rates of transmission will continue to go up. There's no two ways about that. The thing that we can all do to protect ourselves is the same things I'd probably say most weeks. Wash your hands, wear a face covering, keep distance from people, particularly indoors. There's much more chance of transmission indoors than there is outdoors. Avoid large crowds. Follow the rules, the rule of 6, for instance, those are the things that will continue to keep us safe. And most importantly, certainly as we come into flu season, get a flu jab. If you're eligible for a flu jab, get a flu jab, because the last thing that anyone would want to see is someone that has COVID-19 and flu at the same time. We've not seen that before. I wouldn't like to second guess what that might look like. I've had flu once, no one wants to repeat that exercise. So if you're eligible for a flu jab, then get a flu jab.